am scanning the room. I will start from up. And then I will start from the wall. Plug it. No notes anywhere. And then I will go to this wall. And nothing up under the, no one's under the bed. And then this is the floor. Alrighty. Now I will scan myself, my ear, and I will use my watch to just hit record. I am not, there's no notes. It will just only be to hit the record button. And then this is my workstation. There's no notes, front or back, just my name. No notes of any kind, anywhere. No notes. Alrighty, we will start our video. Position my camera. Make sure that I'm in the right spot. All right. Hello, my name is Latresa Stewart. I'm in the FNP program, and I will be the clinician that's doing the head to toe assessment. I attest that I am going to adhere to all the student code of conduct, and that there's no one coaching me. I am not having any notes or anything, and that I'm following the rules and the guidelines. I upload our consent. This is, can you state your name, and can you state your name, your whole full name?
Tanya Martinez.
And your date of birth?
8/17/95.
And how old are you?
27.
All right, this is going to be a student video for grading purposes, and it will be uploaded in the YouTube video. Do you consent that you agree to uploading this video on YouTube for grading purposes?
Yes.
All right. Also, are you aware that I will be doing, I'm your clinician, and I'll be doing your full head and toe assessment. So any abnormal findings that I have, I am not, able to give you any guidelines. You just have to follow up with your primary care doctor, okay?
Yes.
Alrighty, thank you. So we will start our head to toe assessment. I'm gonna start over again. You gave me your name and you gave me your date of birth, and your age is?
27.
All right, and your nationality?
Latina.
You're African American, white,
Hispanic.
like Hispanic. Okay. What is your you say Hispanic, race, age? Okay. And so, where's your date of birth, like place of birth?
Texas.
Texas. All right. And then you're in the United States, correct?
Correct.
All right. And what month is this?
August.
All right. Do you know who our president is?
Joe Biden.
Yeah, Joe Biden is correct. All right, so I'm going to start off with asking you a lot of questions and stuff. So today, what am I doing for you today?
Physical exam.
Okay, so we'll be doing a complete head-to-toe physical exam. And with the head-to-toe physical exam, do you have any chief complaints of pain or any soreness anywhere?
No.
All right. Have you had any symptoms of headaches?
No.
Have you had any symptoms of feeling dizzy or lightheaded?
No.
All right. Have you had any symptoms of blurred visions or any floaters in your eye?
No.
Do you have any symptoms of ear pain?
No.
Ear aches anywhere?
No.
Hearing loss?
No.
Do you have any symptoms of runny nose or stuffiness?
No.
Any symptoms of coughing, sneezing?
No.
Any symptoms of throat swallowing or sore throat?
No.
Any symptoms of difficulty chewing, teeth pain?
No.
Any gum disease?
No.
Any dentures? All right. Do you wear contacts?
No.
Do you wear glasses?
Yes.
You do wear glasses?
Mm-hmm.
Okay. And do you have your glasses with you?
No.
Okay. Do you have any trouble with chest pain?
No.
Any problems with coughing or wheezing?
No.
Any difficulty breathing?
No.
Any shortness of breath? Okay. Do you have any stomach pain?
No.
Any acid reflux,
No.
belching, burping, any fluctuants, passing gas or anything?
No.
Do you have any problems with constipation?
No.
Diarrhea?
No.
Do you have any problems with urinating?
No.
Are you frequent when you urinate? Like, are you noticing it? You're going more often?
No.
Any pain or burning when you urinate?
No.
Do you find yourself feeling thirsty or sweaty at night, or feeling sweaty?
No.
All right. Are you having any chills or fever?
No.
All right. Have you been out of the country within the last 2 weeks?
No.
All right. Are you up to date on your immunizations?
Yes.
Have you had the flu shot?
Yes.
Have you had the COVID shot?
Yes.
What about, have you had your tetanus shot?
Yes.
All right. And when was your last physical?
January 2023.
All right. And did they find any abnormal findings?
No.
All right. Do you have any children?
No.
Are you married?
No.
Are you sexually interactive?
Yes.
Are you with more than one partner?
No.
All right. And who do you live with?
Fiance.
All right. Who brought you here today?
Fiance.
Your fiance?
Mhm.
Do you drive?
Yes.
Okay. And it's just you and your fiance in the home.
Yes.
Do you feel safe in your home?
Yes.
Do you, if you wasn't feeling safe, do you feel comfortable? Let me know if you have any concerns.
Yes.
All right. Do you have your any siblings?
Yes.
All right. How many siblings?
2.
They boy, girl, sister, brother.
Sisters.
2 sisters. What is your mother still alive?
Yes.
And does she have any past medical history, like diabetes?
No.
Hypertension?
No.
Cholesterol?
No.
Is your daddy alive?
Yes.
Do he have any past histories of diabetes?
No.
Hypertension?
No.
Cholesterol?
No.
Or any other medical issues?
No.
All right. What about your siblings? Do they have any hypertension?
No.
Diabetes?
No.
Cholesterol?
No.
All right. Any history of cancer?
No.
Any history of like any breast cancer, pelvic cancer?
No.
What about your mom?
No.
What about your sisters?
No.
What about your dad?
No.
Okay, and what do any of your family members have your grandparents on your mother's side, your maternal grandparents, are they alive?
Yes.
Both?
Yes.
All right, and any medical history of on your grandmother? Does she have any history of diabetes?
No.
Any history of cancer?
No.
Cholesterol, hypertension?
No.
All right, and your grandfather on your mother's side, any history of those things?
No.
Hypertension. On your father's side, his mother, is there any history of diabetes?
No.
Cancer?
No.
Cholesterol?
No.
All right, and your father's, your grandfather on your father's side, your paternal father, his grandfather, do he have a history of diabetes?
No.
Cholesterol?
No.
No history of cancer? Alrighty, and have you experienced smoking?
No.
Do you drink?
No.
Have you ever used illicit drugs such as marijuana?
No.
Okay, what do you do for fun?
Workout.
You work out, and how often do you work out?
6 times a week.
All right. Do you feel any soreness or strenuous, like weak after workout?
No.
Do you feel short of breath during your workout?
No.
No chest pains or anything? Okay. No muscle soreness or anything when you
No.
work out? Okay. Have you ever had surgery before?
No.
All right. Have you ever been hospitalized for anything?
No.
Have you ever had your tonsils removed,
No.
appendix, or gallbladder? You never been hospitalized for anything, okay? Also, your menstrual cycle. Have you ever had any problems with irregular menstrual cycle?
No.
Do you find yourself regular with your cycle?
Yes.
When was your last cycle?
July 2023.
All right, and you have any children? Did
No.
I ask you that? Okay, and you are sexually active. Do you use any contraceptives with your fiance?
Birth control.
Birth control, and how long you been on birth control?
10 years.
So how old were you when you had your first menstrual cycle? Do you remember?
11.
11-year-old, and you've been on birth control since you was how old?
17.
All right, and any problems with blood clots or no history of blood clots or anything?
No.
How is your weight? Have you noticed any change in your weight?
No.
Any change in your eating patterns?
No.
What do you eat for breakfast this morning?
Protein shake.
Okay, and then what did you eat for a snack? Can you speak up a little louder?
Protein bar.
All right, and what do you eat for dinner?
Protein shake.
And then what do you eat like for snack in between that time?
Protein bars.
Okay. All right. Also, I'm just gonna check your just your memory and because you just did some stuff for me, answer some questions for me. What do this have in common? Apple and an orange and a banana.
Fruits.
Very good. And do you remember, like, in your childhood, what can you remember fun about your childhood?
Riding bikes.
Alrighty, you like riding bikes?
Mm-hmm.
Okay. And so, also, ask you a few more questions and then we'll get to your exam. You state that your eating habits are fine and you haven't noticed your weight. What is your BMI?
22.
All right, so when I did your vitals and stuff, I have your vitals. I will do your temperature. I did your temperature, your blood pressure, your weight, your height, and then your respirations and your pulse, okay? And then I'll also check your pulse again, okay? And so also during this exam, I will be touching and stuff. So before I begin my exam, I will be putting on hand sanitizer. And to get that out the way for you. So also a few more questions that I want to ask you is your social activity. You say you like to work out for fun. What is your Christian? What is your do you believe your beliefs?
Yes. Christianity.
Okay, and then also who's your support group? Like, who do you go to for support?
Mother.
Okay. Do you have any outside friends? Do you do anything other than that? What do you do for hobby other than you said workout? Any other fun things you do for your hobby?
Sleep.
All right, you like to sleep, so do I. And so also, I want to ask you, have you ever had history of any mental problems, such as depression?
No.
Any suicidal ideation thoughts? Do you feel like you want to hurt someone or hurt yourself?
No.
Okay. And so those are the questions that I had for you. I've asked you all the questions, no joint pains or anything like that. Okay. And your skin, have you had any problems with rashes or lesions or anything or any concern with your skin?
No.
Alrighty. So now I'm going to go ahead and start with your exam. And I know you're wondering, I'm looking at you, but I'm just looking at the symmetrics of your body and just keep looking at the alignment and everything. Just noticing your breathing and inhaling and exhaling, okay? So the first part of your exam, I'm going to start with just inspecting your head and your your head part of eyes, nose, ears. I'm just inspecting. So I will be touching. I might have to mess up your hair. So I'm just looking at your hair and the distribution of your hair, and I'm just shaking your scalp. And I'm just also looking for any lesions, any lumps, or any tumors, or anything noticeable, okay? And then I'm looking for any thinning, and I'm any baldness or anything like that. Have you had any problems with your hair shedding or any bald spots?
No.
So now it was just massage. I'm just palpating your head, and I'm just looking, and again, I'm feeling for any tumors or lesions or anything like that. And I'm just checking your skin and making sure your skin is intact. I will look behind your ear, and I'm just checking your mastoids. Now, as I start, I'm also going to be looking and just checking this skin and the tuber of your skin. I'm also going to palpate and check your nose, check for any sinus pressure. Do you feel anything?
No.
All right. I'm looking at your eyelids, and they're clear. Then I'm looking in your sclera, and it's pink and moist, and no signs of conjunctivitis, okay? I'm also checking, and then I will start palpating. So I'm just palpating and checking your lymph nodes, just feeling for your posterior and your anterior, and then your subclavian area, and then I'm just palpating down into your trachea. All right. Okay, perfect. And then you can open your eyes. I'm just looking, and I'm just inspecting your ears, and I'm pulling on your earlobe. Here you go. No soreness.
No.
Okay. Again, no ear pain, no ear aches.
No.
Alrighty. And no blur vision or anything like that. Okay, so I'm gonna go ahead and start with your eye exam first. So I will be placing a light into your eye. We'll start off with your right eye, and then you'll cover your left eye. I will use my hand to rest upon your forehead as I draw inward with this light, okay? So we'll start again, covering your left eye, and then I will turn this light on, and then I place my left hand, my right hand, and then I will lift your eye lid up, and then I will go inward, and I see your red reflex, and your optic disc. I see your cut the disc ratio, which is 3:1, and it looks clear. And the veins in your eye, and then you'll cover your right eye, and I will do the exact same thing on the next eye. I will come inward, look, and it is the exact same. All right, pupil reaction to light is perfect. All right, so now you'll cover your eye, your left eye again, and then I will flash this into your eye, the light into your eye. Now I'm just checking for consensual, and then we'll go cover your next eye. Just looking at the pupil for the reaction to light. Okay? Now uncover your eye, and now I'm just look straight ahead at me, and I'm just looking, checking for consensual. Perfect. I know your eyes are getting watery. And so I will have you stand up for me. And you're gonna make a fist like this towards my fist. Thank you. Giving us 6 feet. I will have this Snellen chart, and I will have you cover your right eye. And with can you read the bottom line for me?
LTFPH.
All right. Now cover your left eye. Can you read the bottom line for me?
LTFPH.
All right. And then now can you read both with both eyes?
LTFPH.
Thank you. Right, you can have a seat again. And so I've looked at your eyes, I've checked, it's clear from conjunctivitis. So now I'm going to look at your nose. So with your eyes, what I did was I checked your eyes. So now I'm just gonna go and check your nose, your nostrils, And I'm looking, and there's no mucus. Everything is clear. All right. And then I will demonstrate first. You will take your right hand and hold it on your right nostril, and then I will give you something to smell with your eyes closed, okay?
Mhm.
And then we'll do the opposite. All right, close your eyes, and can you smell that?
Coffee.
All right, let's do the next one. There you go.
Coffee.
Perfect. All righty. So we just did your smelling test, okay? And that is just checking for the smell. So next I will start off with naming your cranias. And so right now we did your cranial nerve number 1, which was your olfactory, which is your smelling. That's why I check for your smelling test. And then I also looked at your cranial nerve number 2, which is your optic. And then I also looked at your cranial nerve number 3, which is your oculomotor. So with your oculomotor, I'm gonna have you cover your right eye. And then I'm going to do the 6 gazes, okay? You're gonna follow this finger, and then I'm gonna move it in different ways, but just look straight at me and then look at the finger, and then just follow me. So cranial nerve number 3 sits 3 and 4. Let's do your other eye. There you go. Nerve 3 sits 4 and 3. Perfect. So also I'm gonna look at the field gaze I'm gonna check and your concentral and your nisatin. So basically I'm gonna have you cover your right eye. You're gonna see my fingers out, and as soon as my fingers come into vision, you're gonna tell me how many fingers I have up, okay?
2. 3. 4.
Okay.
5.
All right, and now do your left eye, okay?
3. 4.
Very good.
2. 3.
All right, thank you. So next, I'm gonna move on. That was your cranial nerve 2, which is your optic, and cranial nerve 3 is your oculomotor. Is what we just tested. We're gonna move on to cranial nerve number 4, which is your trochlea. And then I've already inspected your ear and your trochlea. So now I'm just gonna look into your ear canal. I'm gonna switch out to my optometry so I can look inside your ear. Alrighty, turn the light on, and then thank you. I'll look inside your ear. Okay, so now I'm just checking your ear canal, and it is clear and no debris, and I see your canal, and then it's pearly and gray. I will check here again. And again, the same on this side as well, clear from debris. All right? Your canal is clear. So after I check your oculomotor 4, which is your trochlea, I'm gonna also check your oculomotor 5. So your oculomotor 5 is your trigeminal, and it is basically your jaw. So I'm gonna have you try to stretch your jaw, open and close your jaw, and I'm just checking for any clicking sounds, TMJ. All right, and so then I will palpate. I will place my hand up against your face. Can you press against my face? All right, same. Very good. And then we're gonna move on to your oculomotor number 6, which we already just did. Your oculomotor number 6 is your abducen. And so what we did was did your 6 glaze testing. So next I will move on to oculomotor number 7. So oculomotor number 7 is your facial. So you will smile for me, and can you frown for me, and can you puff out your cheeks? Perfect. And when you frown, can you frown again? I'm just, there you go, just looking at the wrinkles on your forehead. And so we will move on to your, and when you puff out your cheeks on, can you take, like puff out your cheeks again? There you go, just checking for symmetry. All right, so we'll move on to oculomotor number 8. So your oculomotor number 8 is your, I did your oculomotor number 7 is facial, and then your oculomotor number 8 is your abduction. Your I'm just checking. I've already checked your is your acoustics. I already looked inside your ear. I examined your ear, and your ear is clean. So next, I will move on to your oculomotor number 9. Oculomotor number 9 is your glossopharyngeal. So I will have you open your mouth, and then I'm just checking. Let me change this out. Sorry about that. Change this out. And I'll be opening your mouth. And I'm just checking your palate. I'm looking at your gums, your teeth, and checking your mouth overall. Okay? And then we'll move on to your oculomotor number 10. And then your oculomotor number 10, I will have you stick your tongue out for me and say ah. And I can see behind and check your tonsils and everything. All right, and then your oculomotor number 11 is your vagus. No, I'm sorry, your oculomotor 10 was your vagus, and then your oculomotor number 11 is your accessories. So I will place my hand on your shoulder, and can you just, there you go, perfect. And then I will have you do your oculomotor 12, and then your oculomotor 12 is just basically, can you take your tongue and stick it out for me? And I'm just checking for midline, and can you put the crown, and I'm gonna, you just hit it towards both sides of my hand, okay? We'll start off on your right, very good, and then start off on your left, perfect. Alrighty, so that completes your cranial nerve exam. So now I'm going to move on from your cranial nerve exam, and I want to move on to your abdomen exam. So if I can have you lay back for me, and if you don't mind lifting up your shirt, and I'll just pull this down. Right now, I'm just checking the symmetry, and I will grab my stethoscope. So I'm going to be listening to the 4 quadrants of your abdomen. You have your right lower quadrant, your right upper quadrant, your left upper quadrant, and your left lower quadrant. So I will be checking first and just assessing, and then after I inspect, then I will occultate. And when I occultate, I am also going to be listening for regions. Listen to bowel sounds, and I am in your right upper quadrant. Your right lower quadrant, and then now I'm in your right upper quadrant. And then I will move down to your left lower quadrant, and then move up to your left upper quadrant. I was also listening to it on the bell side with the bell in all 4 quadrants. And then I will listen to your aorta. And then I will listen to more over here, and then your epigastric area. Alrighty. And now I will palpate, or percuss your, soft palpate your liver area. So I will start off in your 4 quadrants again, softly, just pressing into your 4 quadrants. Do you feel any tenderness? No. And over here in your right upper quadrant, I'm feeling and just palpating for your liver, and then the edge of it is right here of the size, okay? And then I will go over on your left side, and then I'm also palpating for more of your spleen area, okay? Feeling for your spleen. And then you have your bladder area. And then your renal area, and your iliac area. And then your femur. And the femur area, I'm just palpating. And then I will do a harder press, okay? And then I'm just pressing in the right lower quadrant, and then up to your right upper quadrant, and then your left upper quadrant down to your left lower quadrant. Perfect. And that's just deep palpation. Any tenderness? No. Alrighty. And then your liver, and then your spleen, and then your epigastric area, your aorta, and then your iliac, and then your femur. Alright, and then I will percuss, okay? So I'll start off in your lower, and I'm listening for the dull or tympanic sound. Paranesis. Very good. Alrighty. So that completes your, you can sit up for me. So that completes your abdominal part of it, and your bowel sounds was normal active, okay? So now I will move on into your cardiac exam, where I'll be checking for your breathing and listening to your areas for your lungs, okay? So first I'm inspecting, and I just look at the symmetry of your inhale and exhaling. Can you take a deep breath for me? Inhale and exhale. Thank you. Again. Thank you. And just checking for the diaphragm of your chest expansions, okay? So next I will percuss, and if it was with skin, I will go through it. So I will be touching, areas, but I don't have to lift up your clothes, all right? So right now I will be checking your second intercostal space, which is where your aorta lives on your right side. Okay, so it would be normally right here if you didn't have this shirt on. And then on your left side as well is the second intercostal space, and it will be located here, is your pulmonary valve, okay? And then your third, which will be located on the third in between your intercostal space, is your herbs. And then I have your tricuspid valve, fourth intercostal space, and then your mitral valve, your apex, is in your fifth intercostal space, which is the midline of your nipple, okay? All right, so now that I've palpated those areas, I will listen, okay? I will concentrate what I actually inspected. So I'll start off, and if this was skin, to my stethoscope. Of course, we're not gonna lift up your shirt, in your aortic area, and then your pulmonary area. And then it would be the third intercostal space, your herb. And then your fourth. And I hear no wheezing, and it's all clear. And then your fifth. All right. And then I will use the bell side. So then I will have you turn, can you turn, there you go. Well, let's turn towards the opposite way so the camera can see. I'm gonna move your hair if you don't mind. And then I'm gonna stand here where, make sure they can see me. I'm gonna, inspect your back, and then I will be first inspecting, and then can you turn a little bit more, cause this feels like my back is towards the camera, there you go. And then I'm going to, accossitate. Alright, it's all clear. No wheezing, no bruise or any sounds. Alright. And now do the bell side. Listen to the liver area, bladder area. Alrighty. And then I'm gonna do the test where I'm gonna, can you say 99?
99, 99, 99, 99, 99, 99.
Alright, and then I'm going to press against and put my hands together just to look, feel for your bladder area back here, okay? Perfect. Then I will have you turn back around again, and that same 99, I'm gonna have you say 99,
99, 99,
and then I will listen. Can you say 99?
99, 99, 99, 99.
And can you take a deep breath for me? Inhale and exhale, another deep breath. Alright, and I'm gonna turn around and do that again. And I'm just listening for wheezing again and dullness area. Okay, two panic sounds. Again. Again. And again. Very good. And so that will conclude your cardiac and lungs test, okay? So next we're going to move on to where I'm going to do your sensor test. But before we do your sensor test, can I get you to stand up? So I'm gonna check your lymph nodes, and I'm just gonna palpate your lymph nodes. And I think I did this, your anterior, and then your posteriors, in the back your anteriors, and then I move on to your subclavia, and then I check your trachea. But then I will have you swallow, and then I will stand back and check your thyroids. Can you swallow? Very good. All right, so now we'll have you sit back down again. And so we're gonna move on to your neuro. I'm just checking and looking, and then I will be checking your triceps and biceps, okay? And I'm just checking your legs and just looking, okay? So I'm just inspecting, and then I will check your radius, pulse. Very strong and pulsating and bouncing back at me, very strong and bouncy. And your birth okay. And while I'm at it, I'm going to check your peak pulse, since I'm checking pulse. pulse here. And then your ankle. Very good. Shake and pulse. Very good, very strong. Now I will look at your hands. And I'm going to check your capillary refills. And then I'll return back within 3 seconds. Okay? So I'm just checking each finger. And I'm also inspecting your fingers and your nails and then your skin. And then you are returning back within the time frame on both hands, okay? So have you have your hands out for me like this. And so can you stretch your hands out? And when you stretch your hands out, I'm going to try to close them. Can you stop me from preventing me from closing your hands, your fingers together? Perfect. Now, can you close your fingers? Can you prevent me from opening them? Perfect. All right, and let's check the strength of your hand. I'm gonna have you squeeze my fingers as tight as you can. Perfect. All right, can you hold your hand out for me? And then I'm gonna try to press down on them. On your hands, can you stop me from pressing down? And this is just checking the strength and the reflexes of your hand. Okay, and then we're gonna check for extension and flexing. I'm gonna have you make a fist, and I'm gonna try to flex down on. There you go. There you go. And then we'll do relax your abduction. Can you add is by bringing your arm. There you go. Any pain?
No.
Bringing your arm over. Perfect. And then abduction is taking it out. So we have add and abduction. Same here. Any soreness?
No.
Alrighty. Okay, lift it up. Yes, and flex some. Alright. Perfect. And then we'll shake. Perfect. Alrighty. So I was just checking your shoulder blades and all. Okay? So next, I will have you open your hands out for me. And I'm gonna have you, well, one at a time. We'll do your right. So I'll have you close your eyes, and then I will write a number in your hand, okay? And this is just to see, are you aware of what I'm writing?
7.
Very good. And then we'll do your left hand, and sensors of your left hand, and tell me what I wrote.
8.
Very good. Also, I'm going to place an object in your right hand. And can you tell me what this object is?
Bobby pin.
Alrighty. And then the same thing with your left hand. I'm going to place an object in your hand. And can you tell me what this object is?
Clip.
See if you can feel what this is.
Oscilloscope.
Very good. So next I will have you we'll move on and have you close your eyes. I'm going to be touching areas of your face for sensation, just to tell me if it's soft or dull. Okay?
Soft. 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 Dull. Dull. Dull.
Okay, and then I will move down to your shoulders and your biceps.
Dull. Soft. Soft. Dull. Dull.
Alright, and then your legs.
Soft. Dull.
Can you uncross your legs for me?
Soft. Dull.
Very good. Alright, so once we did that, I'm gonna move forward now to check the sensory of your hearing. We're gonna do the Ron test, okay? I will hit this tuning fork, and then I will place it right behind your mastoid, and then you will just let me know when you no longer hear it, and then you'll also let me know when you no longer hear it that way, okay? I will start off with your right ear.
No. No.
Alrighty, and then we'll do your left.
No. No.
Alright, and then we'll do your Weber test, same thing, but it'll be on top of your head.
Mhm.
And then you know that you will let me know if you can hear it and which ear you don't hear it in, you know, which ear you heard it in, okay?
Mhm.
Or did you hear it in both ears?
Both ears.
Alrighty.
Mhm.
Alrighty. So, did I stand up and now I will do your, I think I did your whisper test, but let's make sure you cover your left ear and you repeat after me.
Apple. Orange. 1, 2.
Alright, and then cover your left ear. You ready?
Orange. 5, 4. Banana.
Alrighty, thank you. I'm gonna have you have a seat. Well, you can stand up for me since you're up. We're gonna go ahead and I want you to stretch out your hands for me and close your eyes, and I'm just gonna watch your balance. This is making sure that you're not drifting away, okay, or drifting to fall. Alright, thank you. You can open your eyes now. And now can you face the wall for me? And then I want you to walk, just regular walk a couple of steps ahead, please. Alright, and turn around. And then can you turn around again, face the wall, heel to toe. There you go. And then back towards me. Perfect. And then, so can you bend down, turn towards here, and can you bend down and touch your knees? And I'm just checking for scoliosis or any abnormality in your spine, and I will palpate just to make sure. All right, perfect. And stand up for me. All right, can you move your neck to the it's my right, which is your left, and then move your neck. Very good. Down, follow me, and then up. Very good. Can you turn? Perfect. Alrighty. So, okay, I'll have you have a seat. So I'm gonna check your reflexes. So I will be checking your bicep reflexes, and I will hit my thumb. Alright, so relax your hand for me. Perfect. And your triceps. Very good. And same here. And then I will check your elbow. So you relax your hand in front of me as I hit that ear bump. Alright. Same here. Relax your hand. There you go. Perfect. And I will do your knees. Just relax. Perfect. Checking your reflex. And then I'm going to check your Achilles. Just relax your feet. I'm going to hit behind. Perfect. And then I'll do the same here. Checking your Achilles. Perfect. And I will also check bottom of your feet for sensation from the ball all the way up and across. Checking your toes reflex. From the ball, same. Very good. The sneeze. Alrighty. Sorry. Excuse me. Alright, so next I'm going to have you lay down for me, and then I'm going to do your motor skills. So can you scoot back a little bit more? There you go. I'm going to have you lift your knee up for me. So with this, I'm going to put your knee, press your knees over to the opposite and you try to prevent me from doing that. Perfect. And can you prevent me from perfect? And I'm just checking your hips and motion. All right. So we're going to abduct, add up, and then abduct. Very good. Then I'm going to also flexion, extension. Alrighty. And the same on this side. And just the range of motions of your leg and the Bezicki side. Just checking. Perfect. Next, I'm going to just check. You can sit up for me. I'm gonna have you lay back down for me, and then I'm just gonna have you turn to the side. Very good. And I'm just gonna check your hip and then your spine, where your coccyx at. Then your knee. There you go. And back. Alright. Alright, and sit up for me. Alrighty, and I'm just gonna check your pedal pulse. And I'm checking each pedal pulse, and they all are returning within the 3 seconds. Alrighty, so I've checked your neurological, I've checked your range of motion, I've checked your muscular range of motion. And now can you stand up one more time? I want to make sure I just check to see, like put my hands on your hips, and I'm just checking to make sure that your legs and they're equally, okay? Like there's no limp or they're the same. All right, you can have a seat. So I think we covered all of your physical exam. We did your head to toe exam where I did your range of motions. I did your neurological, I did your cardiac, your abdomen, and your head to toe where I did your head and your cranial nerves. Do you have any questions for me?
No.
All right, and I want to thank you.
Thank you.
All right, turning off my video, which is right here.